日米知識人交流オンラインセミナーにご参加いただきありがとうございます。私は国際交流基金日米センター所長の塚弘子です。日米センターは1991年に日本と米国で世界の共通課題に対して検討していくこと、それから日米相互理解を促進していくことを目的に設立されました。2015年からは日米知識人交流プログラムをはじめ、米国ユダヤ人協会のご協力によって、ユダヤコミュニティの優れた方々を毎年招聘してまいりました。今年度はグローバルヘルスがご専門のコロンビア大学キャサリン・パイク先生をお招きする予定でしたが、あいにくコロナウイルスのため訪日が叶わなかったため、このようにオンラインでセミナーを開催することになりました。パイク先生はコロンビア大学で教鞭を取られるほかに、グローバルメンタルヘルスの分野で WHO の人材育成センターの所長を務められるなど、精神衛生、教育、女性の健康に重点を置いて、国際的なイニシアチブを取ってこられました。新型コロナウイルスでは、都市封鎖や人の移動、人の集まりの制限がされるなど、私たちは未知のウイルスへの不安や経済的困難、顕在化、拡大する様々な格差によって大きなストレスを受けています。今回のセミナーでは、コロナ禍におけるメンタルヘルスをテーマに、日米の文化による違いや、私たちがこれからどのように対処していったらいいかというようなことについてお話を伺うことになっています。モデレーターには、様々な分野の女性リーダーの交流に取り組まれてこられた笹江信子さんをお招きしています。それでは、セミナー開始に先立ちまして、共催団体である米国ユダヤ人協会のシーラ・ローエンバーグさんから一言ご挨拶をいただきたいと思います。シーラさん、よろしくお願いいたします。
Thank you, Tsuka-san, for your kind introduction. AJC Asia Pacific Institute has been working in Japan for more than 30 years, supporting the US-Japan relationship, as well as fostering a greater understanding between the Japanese and Jewish people. We work with a number of important interlocutors, including government officials, think tanks, academic and civil society leaders. We've been honored to work with Japan Foundation's Center for Global Partnership for more than 5 years. As Tsuka-san mentioned, typically our programs have brought Jewish Americans and Japanese speakers both to Japan and to the United States in person to speak with a variety of audiences and experts. But this year, like so much of our lives, things are different because of the COVID-19 pandemic. We cannot bring you our speaker in person, but due to the wonders of technology and our increasing facility with virtual communication, we're fortunate to be able to bring our speaker to you nonetheless. It's a great pleasure to be introducing this timely program featuring Dr. Kathleen Pike, interviewed by Ms. Nobuko Sasae, focusing on mental health in the context of the COVID-19 pandemic. COVID-19 has disrupted our lives in many ways, and being a global pandemic, every single one of us has been affected. Dr. Pike will share some of her observations about the ways in which the pandemic has affected us all individually and as a society, as well as the difficult choices that governments must make moving forward. Sharing her expertise in mental health with us is an invaluable service. On behalf of AJC Asia Pacific Institute, I'd like to thank Dr. Pike and Ms. Sasae for joining us for this important program. Thank you also to our partners at Japan Foundation's Center for Global Partnership for making this and previous programs possible in this ongoing series. We very much look forward to our continued collaboration and presenting these speaker programs in person again in the not so distant future. I turn this program over to Ms. Sasae and Dr. Pike. Sasae-san, Pike-sensei, yoroshiku onegai shimasu.
シーラー・ローエンベルグさん、ありがとうございます。そしてまた国際交流基金日米センターの塚所長、ご親切な紹介をありがとうございます。本日はキャスリン・パイク先生との対談、メンタルヘルス・マターズ、 新型コロナウイルス感染症とその先のことという対談をやらせていただきます。モデレーターの笹江信子です。2020年の初めにコロナが始まって、依然まだその猛威というものが続いております。その中でメンタルヘルスに関するコロナの影響というものがいろんなところで議論されるようになりました。なぜコロナというパンデミックがこのようにこの人々の心に大きな影響を与えているのか、そしてそこではコロナの感染の影響そのものとともに、やはりその我々が住んでいる文化の与えるメンタルヘルスの影響というものを同時に考えていかなければいけないように思います。その面で、コロナのメンタルヘルスに与える影響、そしてそれを文化的な要素を加味して考えるというこの本日のこの内容に関して、これほど素晴らしい先生はいらっしゃらないという先生をお迎えしております。キャスリン・パイク先生はメンタルヘルスの専門家としてその治療法とか、あるいはさまざまなリスクファクターの研究をなさっていらっしゃいますけれども、特に先生は1999年から2010年の10年にわたって日本にいらっしゃったということで、日本におけるメンタルヘルスの状況というものを熟知していらっしゃいます。ですから、今日はその先生の経験というものも踏まえて、このコロナのメンタルヘルスに与える影響というのがどんなものがあるかということを文化的な考察も含めて、日米の比較ということも考えながら理解し、この討論していきたいというふうに思います。それでは最初に先生からオープニングステートメントをいただきたいと思っております。Thank you, Kathy, for joining our program. First of all, can you invite you to give us your opening statement?
Sure. Thank you very much. It's really an honor and a pleasure to be here. And I greatly appreciate and respect your interest in talking about mental health during COVID-19 and beyond. It is frequently people refer to a shadow pandemic or the second pandemic, another wave of a pandemic, when they are thinking, these are headlines in the news today that are raising concerns for people around mental health due to COVID-19. And the concerns are real, and the data are real that the mental health burden associated with COVID-19 is significant and is having an impact across populations around the globe. And it is really a time when I have, unprecedented in my career, have seen governments and schools and workplaces and citizens talking about mental health in the way that they the observations and the experiences and the significance of mental health concerns be so widespread and so widely recognized and part of everyday conversation. So I think this is a moment for us because it is, as much as the mental health concerns are real and serious, we also have an enormous opportunity to step up and address the mental health needs that are emerging because of the stresses of the pandemic. So I look forward to talking with you about what these stresses are and what we can do. But I think right from the outset, I want to say they're real and they're serious, and there are things we can do so that we don't have a shadow pandemic. That is not inevitable. But if we don't pay attention now, we'll have serious problems on our hands around the world and across countries.
Well, thank you, Kathy. You mentioned opportunity in your opening statement. In spite of the very serious, the real the issue facing us, I'm very happy at the very beginning to hear the word opportunity here. But I would like to start from the overview of the current pandemic situation. and particularly its impacts on the mental health. And I'd first like to know, what are the different components which cause the mental health issues in this pandemic? In other words, what has been unusual? What has stood up in this experience of the pandemic now?
Mm-hmm. So a piece of what is so dramatic is how widespread the mental health concerns are. So the data that are emerging from Japan, from China, 35% of people, individuals in China, expressed experiencing psychological distress due to COVID-19. 35%. 80% of respondents in India felt that their mental health was impacted by COVID-19 in another study. 1 in 4 Americans is describing significant mental health impact of COVID-19. So, and this goes on, study after study after study. So the first thing that stands out is that nobody is getting through this pandemic without a heightened awareness about mental health. And what we're seeing, so what's really important to note, however, is that feeling anxious, feeling concerned, feeling worried, feeling fatigued, those are normal, healthy responses to a global pandemic that we have not seen in a century. And it's extremely, extremely important that people understand that when they feel anxious, when they feel worried, when they have difficulty concentrating as a result of this pandemic, that's their emotional, psychological world telling them that something's not quite right with the world. And that's absolutely true, right? So we would be a little bit worried if nobody was worried, a little concerned, right? If people weren't anxious, right? This is normal, healthy, emotional response. The problem is, or the concern is, that you want to watch for how severe is the response, how long does it endure, and how impairing is it. So severity, duration, and degree of impairment. And what's happening now is because this pandemic is wearing on and on, the people's resilience and coping gets worn down. And so then you have a group that's really vulnerable to real mental health concerns that that need to be addressed at a different level. Mental health concerns of concern and worry and fatigue, they need to be addressed, but they need to be addressed in a different way from the situation when someone develops a real psychological disorder that needs real focused professional intervention. Exactly. So what we're seeing is a increase, as I said, in anxiety, increases in depression or depressive symptoms, increases in sleep problems, increase in concentration problems, worry. So, and when that all comes together, it can become a real syndrome that requires more professional intervention.
That's very helpful for us to remember. And so now, under this pandemic, which is so widespread, everybody is subject to the threat of the corona. So we feel all anxious. Not only the person exceptionally feels anxious, but everybody is subject to anxiety, depression equally. And that's a very unique situation. And you said that almost everybody is subject to this, the impact of COVID-19. But are there any specific groups of individuals who are greater risk and more susceptible to the corona-induced mental distress.
Yes, certainly. So on the one hand, the pandemic doesn't play favorites. So everyone gets a chance to be exposed. But on the other hand, there are groups that are much more vulnerable in terms of the mental health impact. There are 5 groups in particular that I would highlight based on the data that we have so far. One is older adults who are more vulnerable to the virus and therefore also more likely to be isolated right now around the world. Obviously, different countries have different public health practices and policies, but many are practicing physical distancing.
Yes.
And physical distancing does not have to mean social distancing. So I like to make a point of distinguishing frequently at the beginning of the pandemic. There was a lot of talk about social distancing, and I think it is it's not just semantics. It's helpful for us to think about it as physical distancing and figuring out how to stay socially connected when we're physically distant. But for older adults, some of the technology solutions that we use, like you and I are having this conversation with technology, right?
Yes,
and we can connect and we can laugh and we can see each other.
That's true.
But a lot of older adults are not familiar with the technology, don't feel comfortable. Older adults have more difficulty hearing, and so sometimes the technology doesn't work for them, and that makes it much harder. So older adults are at increased risk for more serious outcome if they get the virus, and therefore they're also at more serious risk for the mental health burden associated with physical isolation or physical distancing because of the technology hurdles related to connecting. The second group that's at increased risk are, in fact, those who develop the virus and who contract COVID-19.
Trauma.
The trauma of that can be very significant and can result in the data that have recently been released indicate that when someone's been, at least among those who have been sick enough to have been seriously ill, and certainly those who have spent time in hospital, that the anxiety and the sleep disturbance and the fears that follow are quite significant. And just anecdotally, I can tell you, early on in the pandemic, my brother-in-law contracted COVID-19. He's a surgeon. And while he was sick, my sister was keeping the family apprised of how he was doing. And we knew it was serious. But when he came out of being sick, and he's doing well now, he told us that it was the most frightening experience of his entire life, that it was harrowing, because this virus is so unpredictable.
Yeah, that's true.
That if you feel better, think, uh-oh, within a few hours, I could be so sick, I'm going to be rushed to the emergency. And if you feel sick, you think, uh-oh, within a few hours, I could be rushed to the emergency. So there's no peace. So that's very serious, those who have contracted COVID-19.
Yeah, I understand. Yeah, please.
I'm sorry, go ahead.
Yeah, I understand, because if, we start coughing, we just feel very anxious now that I may contract the COVID somewhere. So I can, fully understand that feeling. Yes.
That's right. If you're on the subway or you are in a restaurant, even if the restaurant is spaced out, if someone coughs, everyone looks, right?
That's true. You become so alert.
Hyper alert state.
Hyper alert. Yes. Yeah. Right. Please.
Yeah. So the third group is the group that had mental health problems in the past. So individuals who had mental health conditions previously are more vulnerable. And so the individuals who have anxiety disorders, you know, this is a disorder that causes people to feel anxious, even if you didn't have an anxiety disorder in the past. People who are prone to depression. This is a disorder that really is asking people to cope with a lot of difficulty, and that can be very taxing. So individuals with a past history are at increased risk. The fourth group, there's a very large number of people around the world. In the US, a very high number, fewer in Japan at this point. I hope that stays the same, but many people who have lost a loved one. And the grief, the bereavement process has been very challenging because people who die in the hospital and are not able to be with loved ones, and then not being able to have engage in the ceremonies and the funeral that would typically happen, creates a unresolved grief for many people. And so this is something to be sensitive to and aware of in terms of just increased mental health vulnerability. The fifth group that I would mention is the group of individuals who actually work on the front lines in terms of providing mental health services. I'm sorry, not mental health services, but health services. The healthcare providers who are on the front lines. It is an enormous burden that these individuals are carrying for all of us in trying to care for individuals who are sick with a very, very serious and seriously contagious virus. And that group is at increased risk for acute response to an acute stress response. Most of the individuals who work in that capacity within a reasonable window of time and with the right supports do just fine in the long term. But in the short term, they need and deserve additional supports. So then the fifth group that I would identify is the group of those whose economic livelihoods are threatened. So I'm sorry, I think this is the sixth group actually. So the sixth group is those whose economic livelihood is threatened. And that's a really important point we can come back to, but the pandemic has been very disruptive to small business owners in particular.
That's very true. That is very, exactly the same. And in Japan, the economy has been hit very hard. And I think that's the same in America. And the number of people who lose jobs or who even have to, lose their the houses. Know how much their stress could be is just beyond our imagination.
Right.
And
the last group that I'd like to mention
please.
is women. So we can explore that further separately, but the data are emerging fairly clearly that women are at increased risk for mental health burden, mental health troubles following in the context of COVID-19, in large part because women provide the majority of frontline health care.
The same here in Japan, yes.
Women provide the majority of caregiving for older adults. Women provide the majority of caregiving for children. Women are much more likely, therefore, to experience intense role conflict as a result of having to do their jobs and take care of children who used to be at school and take care of parents who now need extra support.
Yes.
So women are at significantly increased risk.
Yeah. Thank you, Kathy. Yeah, please. Kathy, I'm so curious to know more about the impact of COVID on women, because both you and I have been studying the gender issues in women. So I'm so, eager to know how the women are impacted by the COVID-19. And just quite recently, I read a newspaper article that in Japan, the female suicides jumped by around 80% in October, compared to the same period last year. And of course, male suicides increased, but smaller, the percentage by 20%. And so I just wonder, is this a universal trend in the world that the women are more affected by COVID-19 than men?
Yes, that is correct. So women are disproportionately impacted. The data seem fairly consistent around the world. And it is, our understanding would be that the reason that women are disproportionately impacted has to do with the fact that women are providing this frontline medical care. Majority of nurses are women, and nurses provide the majority of medical care in the hospital. Women are also more likely to be in domestic roles as housekeepers, caregivers, and this is work that cannot be done from a desk, right? So you can't say, okay, I'm going to be a caregiver, or I'm going to be a housekeeper and stay at home. So either you are exposing yourself to the virus in a way that is a higher risk, or you are now in a position where you, as a woman in those roles, have lost your income. And so women are also, another thing that we're seeing, Nobuko, which is very troubling to me, is that we're seeing very significant increases and reports of interpersonal violence against women at home, domestic violence.
Domestic violence, yeah.
And so that is a very, very seriously associated with everyone being home and in a small space, and that increases mental health risk. And so when you put that all together, the combination of the psychological stresses and the potentially loss of income, the exposure to the virus, and the role conflicts around wanting to care for members of the family and being pulled in a lot of directions, it puts women at very, very substantially increased risk.
You mentioned that when the family members stay together in a closed setting for a longer time, there is a greater chance of the stress or strain or conflict. And in Japan, there is a saying that it is the best to have the husband who is healthy but not at home. And well, this is quite valid in my mother's generation, and to a certain extent to our generation as well. I don't know much about the younger generation, but since the husband and wife constantly stay together, work from home together, that increases the stress. So do you expect that more divorce cases are likely in America or in the world as a result of being together for longer time than the ordinary, the times?
There's speculation that will be the case, and it maybe in some of those situations that's the better outcome. But what I would say is that in the same way that in the big picture, it doesn't have to be that way. It's the same within the family. So the what is so important at this moment in history is that we recognize that people are stressed, that people are fatigued, that this is very challenging for different people in different ways, this pandemic. And people are fatigued by the WHO, the World Health Organization, just came out with an expression that they called the infodemic, right? So there's too much information. Too much, right? We're just overwhelmed. And so there are many real stresses. And to the extent that we as communities, what I think, I feel very strongly that the next 6 months is the real test, because the next 6 months will ask societies what they value and who they value and what they're going to do in their policies. What social policy, what labor policy, what financial supports are you as a government? What do we as a people value and respect, and what are we going to do to support the communities and support the people who are vulnerable? Because the truth of the matter is that societies are going to, there's a cost. This pandemic is going to cost us. It's going to cost everyone around the world. And the question is, how are we going to pay? Are we going to pay by letting people die? Are we going to pay by actually using government funds to subsidize employment so that people can remain employed and therefore not increase and therefore avoid the increase in suicide? Are we going to support teachers? Are we going to support parents? And this is the test. This is the real test. What are we as a society going to say really matters? Because we're going to pay one way or another. The society is going to bear the burden of this pandemic. And so it really, the test is, how are we going to respond?
And well, there is no doubt that there is a lot of cost associated with that, but if we learn the lesson and try to learn from this lesson to move in a better directions, that gives us some beneficial the results from this very sad experiences. Well, just I would like to dig further into the discussion about working from home. That is a very, new reality for many of us. And for women, I believe that working from home, that should have been a dream. That we have been waiting for the flexibility associated with working from home. But when it became suddenly a reality as a result of COVID-19, we found it rather stressful to make our work and family compatible. And so there are a lot of complaints that heard, particularly the women with children under a certain age have a difficulty to make the work and family compatible. And how the women in America feel about this now?
Absolutely right. The issues of it, there's an American expression, an English expression is, be careful what you wish for, right? So everyone wished that we could just work from home. And here we are, and people are saying, wait a minute, this isn't what I meant. So yes, it is very challenging. There have been, again, I think there have been some real opportunities, and there are many individuals for whom working from home works very well. And it has freed them up, and they are not commuting. My future daughter-in-law, my son's fiance, is working from home, and she was commuting an hour and a half each way. So she gained 3 hours of time. but she does not have young children at home. Right? So for different people, it can really be a terrific opportunity. There are, I see lots of young professionals in the United States who are experimenting with living in all different towns and cities. I have a young professional on our team who decided to move to another country. And so these are the kinds of opportunities that came with it. But for many people who have family responsibilities, as you say in particular, and again, in particular women who really lead on that in many families, the role conflict that comes with not having the boundaries around work are pretty intense. And you know, in some ways, this Zoom world that we live in makes everyone a little bit more three-dimensional and a little bit more personal. Like I can see, oh, look at Nobuko-san's family photos on the bookcase, right? And it makes people very, you get to a little glimpse of the whole person, which is wonderful, right? And someone's dog barks, or someone's little kid walks in and bangs on the door, and so there's a way that people become more three-dimensional, right? Their whole lives. But that can be stressful. It can be stressful for young professionals. It can be stressful because you've got maybe two adults in the house who are both working and they've got young children, and the house is small, and it wasn't designed for two children to be on Zoom for school and one on, two parents on using technology. So the stresses are very real. You're absolutely right. And one of the things that's, again, this is the test. This is an opportunity for companies and for leaders in business to have an outsized opportunity to support their employees and to provide, be role models and to communicate in ways that alleviate the anxiety and create some flexibility at this time of stress so that employees can cope effectively and thrive. And it really is an enormous opportunity. I want to mention that I had the opportunity to work with AXA and Gordon Watson, who is leading the work as CEO of AXA Asia. He's leading the work for the whole corporation around mental health and work. And we worked together on preparing a toolkit for leaders in business around mental health and COVID-19, supporting employees during COVID-19 and beyond. And we'll share that toolkit. It's open access. We invite everyone and anyone who would like to reflect on how they can most effectively lead during this time to download the toolkit and make use of it, because you really can have a huge impact. Even very simple strategies can make a huge difference in people's lives at this time.
Kathy, I think that's very useful information, because rather than thinking about things in abstract terms, if we are able to have access to concrete tools to help us, that's truly a good news. And as you say, the leadership matters here again, and leadership matters even more than ever under the pandemic. I fully agree. And I'm fascinated by your reference to the three dimension. Well, it's the first time for me to hear that this Zoom world gives us more three-dimensional approach than otherwise, because people tend to miss three-dimensional things on Zoom. But you say that, yes, we share the photos and the part of our life to the people through online and Zoom. That's interesting observation. Thank you very much. And you already mentioned the impacts on women, and as a Japanese woman, I'm very interested in its impact on women in the context of Japanese culture. Because, for instance, in Japan, as you know, the burden of housework, the childcare, is even heavier on our shoulders. So we have to be even more mindful about the impact of working from home, even after the COVID that comes to an end. So I'd like to a little bit, further dig into the discussion of cultural risk factors here, because I'm so keenly interested in that. But before doing that, I'd like to know why you, came to Japan, or what made you, come to Japan. I'm very curious about it.
So coming, as you said, I had the opportunity to be in Japan from 1998 until just the end of 1998 until 2010. And
for more than 10 years.
Yes.
Wow,
and,
that's long.
Almost 12 years. And it was a chapter in my life that I will always treasure. Japan, I was in Japan with my family, and it was an extraordinary privilege and opportunity to live in Japan. And so I thank Japan for sharing so much with me. And also, even beyond Japan, I live in New York. So Japan is very far, and the rest of Asia is very far. So being in Japan, we also had the opportunity to see a part of the world, the region, that we would not have been able to see. And we came because it was an opportunity for our family in terms of work opportunities. And for myself, I had the opportunity I was doing a study looking at risk factors for eating disorders across culture. And so, yes, we share this interest in women's health, the two of us, and the question was, what puts women at risk for eating disorders, and are the risk factors similar or different in different cultures? And so I had the opportunity to go to Japan. I was granted a faculty research award, and we went thinking it would be 2 or 3 years, and we stayed for 12 because it was such a rich opportunity. And while I was there, I served as the Associate Dean at Temple University in Japan, and also had a visiting faculty appointment at Keio University in Japan. So, and there I continued my work looking at culture and risk factors for mental health, and differences and similarities across cultures. Yeah.
And eating, you said that you studied eating disorder, and eating is such an important part of our life, and is related to very closely our health. So must be a very interesting subject of study from comparative perspectives between Japan and the United States.
Yes.
Yeah. So you spent 10 years. Yeah, you spent 10 years, and 12 years actually. Yeah. And based on your first-hand experiences in the field, have you found any difference in terms of people's response to addressing the mental health issues or mental health concerns in Japan compared to that in the United States?
When I first arrived in Japan, it was a time when, in terms of mental health, the field was very much dominated by medication and psychiatry and medication. And over the time that I was there, it was quite remarkable to me to witness the evolution of the Japanese people, really the Japanese community wanting more and engaging more around other strategies for addressing mental health concerns, in particular psychotherapy. So when I first arrived, there were very few people were talking about psychotherapy. By the time I left, most of the psychiatrists and the growing community of psychologists had wait lists because the Japanese people wanted to participate in psychotherapy. So that was quite a dynamic observation for me. I had the opportunity when I was there to serve as the vice chair of the board for TEL, which is the English complement to Inochi no Denwa. And so TEL has a lifeline, and also I think in contrast to Inochi no Denwa, it also has a face-to-face counseling service. And Dr. Tsuyoshi Akiyama was the board chair, and we worked closely together in developing the mental health services there with the team, both the lifeline and the in-person mental health services. And the service itself grew dramatically over the course of those 12 years. So my observation is that in Japan, although many Japanese people would say to me that people like to keep their privacy and don't like to talk about their mental health concerns, and that may be true, and I think is true, but that in the right context, having the opportunity to speak to someone who is professionally trained, who they can speak to confidentially, actually is something that many Japanese individuals came to very much appreciate and value. In my observation of the usage of psychotherapy really grew. So that was one of my observations around mental health. I also, an observation that I have around mental health that I think is also relevant to the discussion around COVID-19 is that the American culture, the United States, I like to say the United States is intoxicated with autonomy and independence. The US is at one extreme in terms of valuing independence. Japan is at the other extreme of valuing community and collective, right? Putting the collective first.
Yes.
And each extreme has again, as is the case in most of life, there are really good things about independence and really good things about collective. Taken to the extreme, either one can we pay a price. Right?
Effects, yes.
And so I think in Japan, one of the things that I always admired about Japan in understanding mental health and in the work that I was doing in understanding risk factors for mental health conditions was that commonly it was very, very much understood that the community and the collective had to reflect and understand what is the role that the community might play in putting someone at risk, right? So for example, to be more concrete, the ideas around work stress syndrome. That's a very Japanese conceptualization.
Is that right?
Because it speaks about the burden of work and the work structure, and that as a work environment, we need to think about the environment that we are creating that's putting people at stress. It's creating so much stress that people are not able to perform. Whereas in the US, it's a very individualized diagnosis. So that kind of difference is very notable. And right now, with the pandemic, for example, in the United States, we have just a war going on about wearing masks.
Yes, I know.
And my Japanese friends just laughed, just like you laughed. Everyone laughed at us. They say, what is going on?
What is going on? You're right. What is at stake? Yes. Right.
So,
that's one of the things that we do not understand very well about why that is such a serious political problem there. Yes, so you have already referred to partly the people's reluctance to talk openly about the mental health. But do you think that in Japan, the stigma attached to the mental health compared to Western society is still the higher? In other words, people's fear of the being, discovered. That seems to be more prevalent among the mental health patients and their families in Japan than in Western societies. And if so, why do you think this is the case? And how we are able to overcome this serious issue related to the stigma attached to the mental health?
This is a central question in terms of advancing understanding around mental health and getting people treatment, right? Because if stigma gets in the way of people getting good information and getting good care. So it's such an important area of focus. And I think you are right, Nobuko-san, that it is my observation and my Japanese community of friends would agree with you that people want to keep things more private and are concerned about being found out, right? But it's not just privacy, but it's a certain shame or secrecy. And I think that the data will tell us in terms of addressing stigma that some of the things that are very effective and important in terms of changing stigma is having individuals who have experience with mental health challenges, having people talk about them and share their own experience makes it creates permission, gives permission to the larger community to also share. So this is another place where individuals who are in leadership roles can have a very significant positive impact by talking. And this is an opportunity with COVID because it's so widespread that people are feeling mental health stresses and concerns. And it is so understandable that to talk about it it opens the door, as we say. And when someone in a leadership position says to, let's say, a leadership position at work says to their team, this working from home has been really stressful for me this week. I'm going to need to take a morning off and take a long walk in the park and take a few hours for myself and for self-care because it's just been so stressful. That goes so far in terms of modeling self-care, in terms of modeling an understanding of the very real mental health concerns, in terms of modeling that it's okay to talk about it, and to convey that if I do this, I think I'm going to feel better. And so I want you to know that I see for myself that there are mental health stresses, concerns, problems, worries, and it's okay to talk about it. And if we talk about it, and that gives us the space to take care of it. And if we take care of our mental health concerns early, then we have a much better chance of fully recovering. So that's the opportunity. That's a real opportunity at this moment with COVID-19.
Thank you. That's a very important message. Thank you. And now I would like to move on to the practical tips to cope with the problems. And because for viewers of this program, I think they are interested in how we are able to cope with the mental stresses and the COVID-induced mental stresses. And I think you mentioned somewhere the mental resiliency or the what you call mental reserves to brace for the moment that will be difficult in your life. And I'm interested in that. So can you elaborate on that, please? And
Sure.
if you have your own coping methods, please share them with us.
Sure. So I think the most important, or the important starting point is for all of us to recognize that this is a very stressful time. And we build up, right, these emotional reserves or the resilience reserves. We have them ready for when we need them in life. And so for many of us, we have this, this little pot of reserves that we can use to cope during these times. But we should recognize that we're spending them. We're spending our reserve units, like drawing money out of the bank, right? And that it's really important to also take time to think about how you can put some reserves back in the stores. How do you take the banking image really works well here, right? How do you do some things that create some resilience that you can put back in that pot for another day? And so things like recognizing that things are not normal right now, and letting go of trying to make it normal, and say, it's not normal right now. This will pass. So let me think about what can I do during this pandemic that I am not going to be able to do when everything is normal again. Right? So there will be some things that people have wanted to do that they have not been able to do, myself included. I had a garden project. So I have been wanting to work in my garden for years, but I never had the time at the garden every day. But since I'm working from home, I can spend even just a little bit of time every day. And so this summer I had a garden that had tomatoes and had basil and had
exactly the same in my garden. Yes.
And it was wonderful. It was so wonderful.
And flowers starting blooming.
Right, exactly. And one day I would see the flowers, and the next day I would see the tomatoes, or one day I would see the basil, and the next day the rabbits had eaten it. And so it was such a release.
Yes.
It was such an outlet. And it didn't take a lot of time.
No.
I was in the garden maybe 20 minutes, maybe a half hour. And those kinds of things are really important to find because there are opportunities during this pandemic.
Yeah, that's right. You feel more positive about time given by the COVID, that the special, kind of luxury that you cannot enjoy during the ordinary times. And also decluttering or tidying up your house.
That's right. Exactly.
Put your house in order.
Exactly. We cleaned out several closets.
Right,
exactly.
Yeah.
And I would also say, I am also very much aware that this is a window of time where there are people who really are struggling. And the pandemic has impacted them in very real ways. And so the other thing that I keep in mind for myself is that when I'm feeling stressed, if I don't go out in the garden, I try to think about one person who I can send a text to. I can send a one-line text that just says, "Hi, Julia, thinking of you. I hope you're doing okay today." And as soon as I hit send, that I feel a little bit better, right? Because one of the surest ways that we can feel better and feel less stressed is when we have an awareness of helping others or being available to others. And this is a time when there are people who need just a little hello, and it will go a long way.
Well, that's such an important message. And somehow I feel that COVID reminds us what is most important in our life and who are most important in our life. That's very interesting experience for us as well. Well, thank you. And I'm conscious about time, but I just lastly, you already mentioned partly, but what kind of the public policy initiatives do you think are effective or corporate the programs effective during the COVID era and beyond?
These are, as I said, I really think the next 6 months, maybe 6 months to a year, these are the months that are going to test us individually and as societies. And at a government level, the government policies around supporting individuals who have been very sick because of COVID, or who have lost their jobs because of COVID, or who have mental health issues because of COVID, will be able to recover or will be able to remain engaged in society as a function of government policy. So there are governments around the world that have made very intentional decisions about supporting companies during this time so that the companies can continue to keep employees employed even though they are under economic stress. That is an economic decision, it's a labor decision, but it's also a public health decision because the society is either going to pay for supporting people to stay at work, or the society is going to pay for the cost of individuals who develop serious mental health problems and a very serious increased risk around substance use and suicide when there's significant unemployment. So how do we want to address this issue? Because we're going to have to address it one way or the other. So at a government level, I think there are very important decisions around labor, around economic decisions in terms of supporting companies, and healthcare decisions. So what will be covered and what services will be provided to individuals will be extremely important in the next 6 months to a year to help people recover from this time, to regain their emotional reserves, to regain their strength and resilience, and to take up life again as it evolves, because it will be a new world when we go forward from COVID-19.
Wow.
And I think as leaders, there's an enormous opportunity as business leaders to really be models, role models for acknowledging the mental health burden right now and for creating opportunities where there's more flexibility and communication around mental health needs. And it will go a long way to helping us all cope and come out the other side stronger.
Wow, such a wonderful, powerful message. Thank you very much, Kathy. I think I learned a lot, and I believe that our viewers learned a great deal from your discussion. Thank you indeed.
Thank you very much. Really a pleasure.
Thank you. ありがとうございます。皆さん対談を楽しんでいただけたんではないかと思います。ペク先生はメンタルヘルスの分野で長い間スティグマをなくそうというアドボカシーの運動に携わっていらっしゃいました。やはり社会の中でこのメンタルヘルスの問題をオープンに語る、そしてオープンに語るその個人が勇気を持つ、そして社会がそれを受け止めてスティグマ、これは烙印とか偏見ということだと思いますが、それなしにそれに対して対応し、ケアへのアクセス、治療やそのいろんな治療法へのアクセスというものを開いていくという環境を作っていく、これが極めて重要だとおっしゃった、その点は本当に重要だったと思います。そして先生がおっしゃった何度も繰り返された言葉にオポチュニティ、機会ということがあったと思います。コロナというのは大変大きな苦痛をもたらしたことではありますけれども、同時にものすごく大きな変化への機会、契機となりうるということで、我々はこれを契機と捉えてより良い方向に物事を進めていく。で、メンタルヘルスという大きな社会に影響を与えている問題に対しても、やはりこれを契機としてより良い方向に進んでいくということがとても重要だということを先生は繰り返し強調なさったと思います。そこで必要なのがリーダーシップであり、リーダーはここでロールモデルとして皆に今後行くべき道というものを指し示す必要があるということについても本当にその通りだと思いました。ですからこのメンタルヘルスという問題、コロナという問題、さまざまなこの苦痛を伴うことではありますが、現在のこのコロナということを通じて、これは我々の普通のあり得る問題、我々の生活の中で誰にでも出てくる問題として、もっとノーマルな形で向き合うという、直視するということができれば、これは一つの大きな危機がチャンスに変わるという例になると思います。今日は皆様本当にご参加ありがとうございました。これで終わります。メンタルヘルスの相談窓口に関してのリソースがこの後のスライドにまとめてありますので、どうぞご覧いただけたらと思います。ありがとうございました。失礼いたします。